Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. So approximately 50,000 physicians are now pressuring patients in left-wing demographics to register to vote. These doctors were wearing badges displaying QR codes for patients to scan with their phones, which takes them to a website that registers them as voters. The badges and the website were provided by VoteER, a left-wing nonprofit group that promotes voting as a therapeutic treatment for patients. Physicians at the Pennsylvania Psychiatric Institute, for example, claim that voter registration is a therapeutic tool that, quote, helps empower patients and makes them feel good, end quote. Dr. Julie Grazian, an inpatient psychiatrist in the hospital's geriatric unit, says that, quote, voting is an important part of the recovery process, end quote. VoteER founder Dr. Alistair Martin once told a patient who had an asthma attack that voting was the only way to get the smog out of the air. I can't make this stuff up. It's unbelievable. Now you believe me when I say medicine's corrupt. While VoteER claims to be nonpartisan, of course, we welcome everyone. Dr. Martin is a Democrat donor who served as an advisor to Kamala Harris. The organization hosts regular training sessions on medical racism, conducted by instructors who list their pronouns. One of the instructors is VoteER Chief of Staff Leah Ford, who says her pronouns are they, them. Sounds like she needs to see a psychiatrist. And was once Planned Parenthood's Volunteer of the Year. Like Ford, VoteER Executive Director Elia Bhatia is a left-wing radical. She has donated to Hillary Clinton, Joe Biden, and Senator Raphael Warnock, the Washington Free Beacon reports. In her bio on VoteER's website, Bhatia says, quote, she prioritizes diversity and inclusion in all her endeavors, end quote. VoteER is funded by left-wing dark money groups, including the Tides Foundation. The Tides Foundation itself is sponsored by foundations, including, of course, the Bill and Melinda Gates Foundation, George Soros's Open Society Foundations, Planned Parenthood Federation of America, the Robert Wood Johnson Foundation, the Rockefeller Foundation, Google founder Sergey Brin Family Foundation, and many others. But they're nonpartisan, let's not forget that. 64% of clinics that use VoteER's tools mostly serve Black and Hispanic patients, strong Democratic cohorts. This is part of the diversity and inclusion. But they're primarily targeting those groups. Interesting. 29% of clinics serve patients under 24, another demographic that leans predominantly left. Medical institutions who wish to use VoteERs must complete an application, which asks if the majority of the institution's patients are Black, Hispanic, Latinx, LGBTQIA, ABC, 1, 2, 3, 24 and under, or other minority groups. See, they want to be inclusive. The application also asks if the institution, quote, views itself as a space that is designed to serve LGBTQ and all the letters that come after it, communities, end quote. VoteER's penetration of the health industry is deep. Over 89,000 patients had been registered to vote through the organization whose tools are used in emergency rooms where patients are vulnerable, psychiatric hospitals where patients are vulnerable, palliative care departments where patients are vulnerable, cancer centers, substance abuse clinics, and neonatal intensive care units. They know no bounds. Doctors in approximately 700 medical centers used Vote ER materials to register patients regardless of whether they are fit for discharge or psychiatrically stable, pulling out all the stops. In a now deleted press release, Vote ER announced it had partnered with Epic Systems, the country's largest manufacturer of electronic health record systems. Epic's technology allows doctors to enter patients' voter status in their health records. What's that got to do with anything? According to Martin, Vote ER worked with the American Medical Association, the most corrupt medical association in existence, to pass a resolution in 2022 declaring voting a, quote, social determinant of health, end quote. I only have one comment. How well did that work for you this past election? Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.